Hello, I'm Kerry and I'm pleased to present this research snapshot on behalf of professionals and researchers in early childhood intervention, more commonly known as PRECI. I'm here on Dja Dja Wurrung country and I acknowledge the traditional custodians and pay my respect to elders past and present. Today we're discussing the meta-synthesis of qualitative studies, inclusion in the early childhood years, by Drs. Hanline, Eldridge and Robbins. PRECI chose this article for a research snapshot because of its relevance to our understanding of practices and outcomes in inclusive early childhood education and care in Australia. Educating young children with and without disabilities together in inclusive early childhood programs is a critical component of early childhood education and early intervention services. With benefits to all children, the importance of inclusion has been recognised by government departments and professional organisations. For example, a joint position statement in the US between the Division of Early Childhood of the Council for Exceptional Children and the National Association for the Education of Young Children identified as desired outcomes that all children and their families have, and I quote, a sense of belonging and membership, positive social relationships and friendships, and development and learning to reach their full potential. Reported outcomes of inclusive early childhood and early intervention include expanded opportunities for friendship development and chances for children without disabilities to develop empathy, compassion, and a greater understanding of disability. Furthermore, children with and without disabilities are reported to make expected developmental progress in inclusive early childhood settings. This meta-synthesis integrates findings from qualitative research, studying the experiences and outcomes of children when they participate in inclusive early childhood settings. The goal was to promote a broader understanding of practices and outcomes in inclusive early childhood programs. A meta-synthesis was chosen as it may provide deeper insights than a single study, adding depth and dimension to the understanding of educational practices, and has the potential to identify gaps in a body of research. To the knowledge of the authors, no meta-synthesis of early childhood inclusion has previously been conducted. The researchers sought to answer three research questions. First, how do the qualitative studies ensure methodological rigour by using methods to establish trustworthiness and procedures identified as quality indicators for the methods used to collect data? Second, what are the social experiences and outcomes of young students with disabilities and their peers who are developing typically when they participate together in general education, early childhood private and public school settings in the US? And last, what are the learning experiences and outcomes of young students with disabilities and their peers who are developing typically when they participate together in general education, early childhood, private and public school settings in the US? The goal was to promote a broader understanding of practices and outcomes in inclusive early childhood programs. So, what did the researchers do? They used a thematic synthesis through systematic coding of data to generate analytical themes. This offers a new interpretation that goes beyond findings of the primary studies included in the meta-synthesis. This inductive approach involved a three-step process: a literature search and selection, quality appraisal of the primary studies, and synthesis of themes within and across primary studies that leads to the development of new descriptive analytical themes. Rigour was evaluated based on the use of procedures to establish trustworthiness, such as credibility, for example, through data saturation, peer review, time sampling, triangulation, and/or verbatim quotes. Through transferability, through contextual background information, demographics, purposeful sampling, and/or thick descriptions of participants and study contexts. Dependability, for example, through audit trail, code recode strategies, and inter-rater agreements. And lastly, confirmability through reflexivity, information on researcher background, and/or triangulation. Rigour was also evaluated based on quality indicators for the data collection method used. 8 qualitative studies were included in the metasynthesis. Evaluation of the studies indicated that all utilised methods to establish trustworthiness and ensure rigorous methodology for the type of data collected, indicating high quality of the studies. As a result of the analysis of this data, 3 analytical themes were developed. First, children with disabilities had opportunities for access to and participation in general education, early childhood classrooms, resulting in children with and without disabilities learning social and developmental academic skills together. Second, over time, the social interactions between children with and without disabilities resulted in positive relationships among the children and the valuing of the children with disabilities by peers. And last, the students with and without disabilities were autonomous in their interactions, taking ownership of the interactions. This autonomy increased over time. So how might we use this research? The focus of this study on inclusion and its benefits are consistent with early childhood intervention service and policy developments in Australia for the last decade. This metasynthesis provides additional evidence that early childhood inclusion can result in positive outcomes for children, supporting the call to expand the availability of high-quality inclusion programs. Further, the researchers indicate that the findings highlight the need to understand the timing, type, intensity and frequency of pre-service and professional development that results in early childhood educators holding positive perspectives of inclusion. This provides us with further guidance on the development of undergraduate and early career support for early childhood educators and early child intervention practitioners in an Australian context, as well as opportunities for further research. In 2012, Early Childhood Australia and Early Childhood Intervention Australia developed a position statement on the inclusion of children with a disability in early childhood education and care. Australia has also developed national guidelines for best practice in early intervention that has inclusion as one of its 4 quality areas. And there's currently a national project funded by the Department of Social Services to develop an early childhood intervention framework through a consortium led by the University of Melbourne and in partnership with the Murdoch Children's Research Institute, PRECI, SNAKE, the National Voice for Aboriginal and Torres Strait Islander Children, the Association for Children with Disability, and Children and Young People with Disability Australia. So in terms of where to from here, you can find the links on the slide for Early Childhood Australia and Early Child Intervention Australia's position statement, for the Early Childhood Technical Assistance Centre in the US that has indicators of high quality inclusion, and lastly on the PRECI website. Dr. Hanline is from the School of Teacher Education, Florida State University. Dr. Eldridge from the Science Department in Omaha Public Schools in Nebraska, and Dr. Robbins from Department of Special Education at the University of Utah. Thank you for listening to this research snapshot. Please visit the PRECI website for further information and to subscribe to our newsletter so that we can keep in touch.